Did you know that the blood pressure pill you swallowed this morning could be quietly changing your body in ways your doctor never mentioned? Whether you are taking amlodipine, losartan, or lisinopril, ask yourself how much you actually know about what that chemical is doing inside your system right now. I'm not talking about the tiny font on the bottle or the one sentence summary the pharmacist stapled to your bag. I mean, really understanding the mechanics of it, how it works, how it can suddenly turn against you if the conditions are right, and how to spot the red flags that separate a small side effect from a serious medical emergency. Welcome back to Senior Men's and Health, and hit that subscribe button if you are new here. If you're finding this helpful so far, please smash that like button to help us reach more people. Most people I meet are smart, careful, and proactive. They manage their own money and stay informed on the news, yet they often freeze when I ask them how their medication actually functions. And that silence tells me a lot. We need to realize that these aren't just daily vitamins. They are heavy-duty drugs that physically alter how your heart, your blood vessels, and your kidneys operate every hour of the day. But here is the crazy part. Millions of seniors are taking these pills on total autopilot. They have almost no idea what to watch for, what foods to avoid, or when a normal feeling is actually a desperate warning signal from their body. I am going to change that for you today. My name is Dr. Selena Clarke, and I started this channel to provide the kind of honest, clear, and practical health advice that usually gets skipped during a rushed 10-minute doctor's visit. By the time we finish today, you will understand these three common medications so well that you'll feel safer and more confident in your daily routine. You won't be caught off guard by sudden changes. Now, this is where it gets interesting. I want to tell you about a man named Arthur, because his experience perfectly illustrates why this matters so much. But before we get into his story, take a quick moment to drop a comment with your name and where you're watching from. I personally read through these because I want to know exactly who I am supporting in this community. Arthur was 74 years old and a retired engineer with a very sharp mind. He was incredibly disciplined and never missed a single dose of his medicine. His daughter had even set up a color-coded pill organizer for him, and he followed it like a strict construction schedule. When his doctor decided to add amlodipine to his daily routine, Arthur didn't think twice. He figured it was just another blood pressure pill, basically the same as the others, so it wasn't a big deal. That one simple assumption almost ruined a whole year of his life. Within 3 months, Arthur's feet had swollen so much that he couldn't even squeeze into his favorite shoes. By late afternoon, his legs felt like heavy lead weights. He stopped going for his daily walks because moving around just made the discomfort worse. He was terrified, telling his son he thought his circulation was failing or his heart was giving out. He even started searching the internet for heart failure symptoms. The actual answer was much simpler and very easy to fix, but Arthur had no clue because nobody explained that these drugs are not the same. While amlodipine, lisinopril, and losartan all lower blood pressure, that is where the similarity stops. Amlodipine is a calcium channel blocker that relaxes the walls of your arteries so blood flows easier. Lisinopril is an ACE inhibitor that stops an enzyme from tightening your vessels. Losartan is an ARB, which works on a similar system but enters through a different chemical door. That small difference matters way more than you might think. So we have 3 different ways these drugs work, 3 different lists of side effects, and 3 different things you need to keep an eye on. Once you wrap your head around that, you can stop looking at every weird body signal with the same lens. Take Arthur, for example. His swollen legs weren't a sign of heart failure at all. It was just the amlodipine doing exactly what it does to a huge number of people who take it. It relaxes your arteries much more than your veins, which causes fluid to gather in your lower legs. Once we figured that out and fixed it, Arthur was back in his walking shoes and active again in just a few weeks. If you're finding this helpful, go ahead and hit that like button. It really helps us reach more people who need this info. You see, the name on your pill bottle isn't just some random label. It tells you which category the drug belongs to, and that category reveals the pattern of how your body will react. But here is where it gets really interesting. Let's dive deeper into that swelling, because it's one of the most misunderstood side effects in the entire world of blood pressure medicine. It affects a shocking amount of people on amlodipine, and here is the simple truth of what's actually going on. When amlodipine opens up those tiny arteries in your legs, blood rushes in much faster. However, the veins, which are supposed to carry that blood back up to your heart, don't relax the same way. This creates a total imbalance where more blood is coming down than going back up. Pressure starts building in those small vessels near your feet and ankles, eventually forcing fluid out of the vessels and into the tissue around them. The result? Puffy ankles, deep marks from your socks, shoes that suddenly feel too tight, and legs that feel heavy and full by the time the sun goes down. Now listen closely because this is not fluid retention from eating too much salt. It's not your kidneys quitting on you, and it's definitely not the start of heart failure. In almost every case, it's just a predictable physical response to the way amlodipine functions. But here is the crazy part that actually becomes dangerous. It's not the swelling itself that's the problem. It's how people react to it. Some people see their ankles getting big and decide to just stop taking their pills without telling anyone. Their blood pressure quietly shoots back up while they think they've made a smart choice. Others keep taking the meds but stop drinking water because they think they're holding on to fluid. That is the complete wrong direction, and getting dehydrated while on a calcium channel blocker brings its own set of scary risks. Then you have people like Arthur who just suffer in silence for months, moving less and assuming the worst, which kills their quality of life for no reason. If you want to stay in the loop on how to handle these situations, hit subscribe and tap that bell so you don't miss our next deep dive. The right move, and the one thing I want you to take away is this: leg swelling on amlodipine is a conversation you must have with your doctor. It doesn't always mean the drug is wrong for you, but there are adjustments, different timing for doses, or even different meds that can fix the issue. None of that can happen if you don't speak up. If you or someone you love is on amlodipine, let me know in the comments. Have you ever felt that heavy, swollen feeling at the end of the day? You'd be amazed how many people are dealing with the same thing. Now, wait until you hear about lisinopril and the most famous side effect in the AC inhibitor family, the cough. It's not a wet or sick cough. It's a dry, annoying, constant tickle in the back of your throat that gets worse at night and ignores every cough drop or medicine in your cabinet. But here is the part that makes it so tricky. It often doesn't even start right away. Some people might start coughing within the very first week of taking the pill. For others, it takes 3 or even 4 months before that first tickle shows up. By that time, the connection to lisinopril is the last thing on their mind. Since they've been taking the medicine for months with no problems, they assume it must be dust, allergies, or maybe some irritation left over from a cold. They might even think it's acid reflux. If you're finding this helpful so far, do me a huge favor and hit that like button. It really helps get this info to more people who need it. I want to tell you about a patient named Audrey. Audrey was 71 years old and loved spending her days out in her garden. When she started coughing, she naturally figured it was just the pollen from her flowers. It was late spring, so that explanation made perfect sense to her. She started taking antihistamines every day and even bought an expensive air purifier for her bedroom. She eventually told her regular doctor about it, and he ordered a chest x-ray. The results came back totally clear, but 6 months later, that cough was still there, ruining her life. She wasn't sleeping through the night anymore. She was exhausted, grumpy, and starting to worry that she had a serious illness that everyone was missing. When she finally came to see me, I asked her one simple question: when did you start your lisinopril compared to when the cough actually started? She got quiet, pulled out her phone, and began checking her records to do the math. It turned out she had started the medication 11 months before our appointment, and the cough had kicked in about 4 months later. She had never once linked the two together. But here's the crazy part. Once we figured it out and worked with her doctor to switch her to a drug called losartan, which works similarly but doesn't cause that specific cough, the tickle in her throat vanished in just 2 weeks. Think about that. 11 months of miserable, sleepless nights were fixed in 14 days just by connecting the dots. Now, I need to be incredibly serious for a moment because there is another symptom in this drug family that isn't just an annoyance. It is a full-blown medical emergency. If you are taking lisinopril and you notice your lips, tongue, face, or throat starting to swell up, especially if it feels hard to swallow or breathe, you cannot wait. Do not wait until tomorrow to call the doctor's office. Do not just pop a Benadryl to see if it goes away. You need to call 911 or get to an emergency room immediately. This condition is called angioedema. While it is rare, it is very real, and it can shut down your airway much faster than you'd ever expect. A dry cough is a pain, but throat swelling is a life or death situation. Please make sure you remember that difference. If no one has ever explained your heart meds to you this clearly before, make sure to subscribe and hit that bell so you don't miss our next update. But here's where it gets even more interesting. We're moving on to losartan now, and there's a danger here that I find really shocking. It doesn't happen because people are being careless. It happens because people are trying to do the right thing for their health. Losartan, just like lisinopril, deals with the body's system for controlling blood pressure. One side effect is that it can cause your potassium levels to climb. For most people, this stays in a safe zone as long as a doctor is checking on them. But if you add certain common habits into the mix, things can get dangerous fast. You won't believe where this extra potassium comes from. It's not just from eating too many bananas or taking vitamins, it is hiding inside products that are literally sold as the healthy option, salt substitutes. Many of those low sodium alternatives you see right next to the regular salt, often labeled as heart healthy, actually replace the sodium with something called potassium chloride. This can lead to a hidden buildup in your blood that you never saw coming. Imagine a senior who gets told to cut back on salt. They go out and buy a potassium-based substitute, sprinkling it heavily on every single meal. Without realizing it, they are flooding their body with potassium while already taking a pill that keeps potassium levels high. This mix can actually mess with the electrical signals that keep your heart beating steadily. But here is the crazy part. High potassium doesn't always give you a loud warning. It often shows up quietly as strange muscle weakness, feeling tired all the time, or a weird cramping in your legs. You might feel tingling in your fingers or notice your heart skipping a beat. Sometimes there are zero warning signs at all until things get really serious. Think about someone you know, or maybe even yourself, who started using salt substitutes recently. If that person is on a drug like lisinopril or losartan, they absolutely need to talk to a doctor. It isn't that the medicine is bad or that healthy food is the enemy. It's simply that this specific combination, without anyone keeping an eye on it, can create a massive problem that was totally avoidable. By the way, if you are finding this helpful, please hit the subscribe button and tap the bell so you never miss our next health update. It really helps us keep making these for you. Now, this is where it gets even more interesting. It isn't just salt substitutes you have to watch out for. Electrolyte powders, meal replacement shakes, and even some sports drinks are packed with potassium. Since you don't need a prescription for them, nobody thinks to mention them to their doctor, and that is exactly why they are so risky. But there is one specific situation that almost nobody talks about when it comes to blood pressure meds, and it hits seniors the hardest. What happens to these medications when you get a common illness? I'm not talking about a hospital stay, just a simple stomach bug, a few days of diarrhea, or losing your appetite. Even a really hot summer week where you're sweating a lot and not drinking enough water can change everything. When your body gets dehydrated, that same dose of lisinopril that usually works great suddenly becomes way too strong for your system. Your blood pressure can tank. Your kidneys, which are already struggling because you're low on fluids, become much more likely to get hurt. You might feel dizzy, weak, or even faint much faster than you'd ever expect. The medicine stayed the same, but your body's internal balance shifted. The drug is now working in a dry environment it wasn't meant for. This is honestly one of the most vital things I can share with you. Getting sick changes all the rules. If you don't have a plan for what to do, like when to skip a dose or when to call the clinic, you're leaving your safety up to chance. You should have a sick day plan from your doctor before you ever actually need it. Next time you go in, ask them, what do I do with my pills if I can't keep food or water down? It is a life-saving question that almost no one asks. Quick poll for everyone watching. Has your doctor ever actually given you a written plan for what to do when you're sick? Drop a yes or no in the comments right now because I bet most of you have never heard of this. But wait until you hear this next part. Picture a rough week where your arthritis is flaring up. Your knees hurt and your back is stiff. You walk into the pharmacy and grab a bottle of ibuprofen. It's something you've used for years. Totally ordinary, right? It's just something sitting on the shelf that anyone can buy. But now, imagine you're also taking a prescription like lisinopril or losartan. Maybe you're even on a diuretic, which is a water pill to help manage extra fluid. If you're enjoying this so far, smash that like button and let me know in the comments if you've ever mixed these without knowing. This specific combination, when you use it regularly, can actually choke off the blood flow to your kidneys. And if you happen to be even a little bit dehydrated, the risk of a serious kidney injury goes way up. This isn't some rare hypothetical scenario. It's actually one of the most common and most preventable problems I see in my office. The reason it happens is so simple. Most people don't think of ibuprofen or naproxen as real medicine in the same way they think about their prescriptions. They see them as just a quick fix for pain from the grocery store. But here's the crazy part. Your kidneys don't know the difference between a prescription bottle and an over-the-counter one. They only respond to the chemistry. If you're using these anti-inflammatory pills for your arthritis, joint pain, or back pain while taking those blood pressure meds, please have that conversation with your doctor. There are almost always safer choices like acetaminophen, topical treatments, or even physical therapy that won't put your kidneys at risk. You don't have to just live with the pain, and you definitely don't have to accept the danger. There is a better way, and you just need someone to help you find it. Now, this is where it gets really interesting, and it's about something that sounds small but is actually a huge deal: dizziness. Before we go further, hit subscribe and tap the bell so you don't miss our next video on staying healthy. Think about that brief wobbly moment when you stand up from the couch or get out of bed in the morning. The world tilts for a second, you grab onto the doorframe, and then it passes. So you probably just think, oh, I just got up too fast. For a lot of seniors on blood pressure meds, this is a regular experience, and almost nobody mentions it because it feels too minor to talk about. But here is what I need you to hear. For an older adult, just a few seconds of dizziness is enough to cause a fall, and a fall is enough to cause a fracture. A hip fracture specifically can completely derail your health trajectory for years to come, if you even recover at all. This isn't just being dramatic. This is physics and biology working together in a way that we have to respect. The dizziness happens because your meds are doing exactly what they're supposed to do: lowering your blood pressure. But when you stand up quickly, your cardiovascular system hasn't had a moment to compensate. Your blood pressure drops for a moment, less blood gets to your brain, and you feel that lightheaded, tilting sensation. The fix is usually very simple. Just rise slowly, sit on the edge of your bed for a minute before you stand up. Hold on to something sturdy when you get moving. Give your body those extra few seconds to catch up with the change in position. But beyond that, if you're dizzy all the time, or if it doesn't get better after your first few weeks on a pill, or if you feel like you're going to faint, you need to have a real conversation. Your dose might need a tweak, the combination of pills might need a review, or your hydration might need to change. Staying silent about this is a big risk. Now, I want to address something that causes a ton of unnecessary anxiety for people checking their blood pressure at home. Which part of this has surprised you most? Drop it in the comments. You need to know that blood pressure is not a fixed number. It actually shifts every single hour of every day based on dozens of different things happening in your life. How well did you sleep last night? Did you have a cup of coffee this morning? Are you in any pain, or are you just feeling stressed about the test itself? Even things like walking in from the cold or talking loudly right before you sit down can change the results. But here's the crazy part that most people miss: one high number on a random Tuesday morning doesn't mean your medicine has stopped working. On the flip side, one low number after you've been out in the sun and got a little dehydrated doesn't mean your dose is way too high. What actually counts is the long-term trend. You have to measure it the right way every time. Use the same arm, do it at the same time each day, and sit quietly for 5 full minutes without moving or talking. If you're finding this helpful so far, do me a quick favor and smash that like button. Now, this is where it gets interesting, because when people don't have a plan and just react emotionally to every single number, they start making really bad choices. They might take an extra pill because they're scared, or skip a dose just because one reading looked okay. They might even make a frantic call to the clinic about a number that is actually totally normal when you look at the big picture. You have to monitor with a real strategy. Write it down and bring that log to your next visit. Let the real patterns guide you, not a moment of panic. Making that one simple change will lower your stress and give your doctor much better data than a random screenshot of a high number. If you've made it this far and you're learning something new, hit subscribe and tap that bell so you don't miss our next deep dive. But wait, you won't believe how these pills actually function. These drugs work by staying steady in your body. They aren't meant for spikes and gaps. You shouldn't take extra when you're worried or skip them when you feel great. Drugs like amlodipine, losartan, or lisinopril are not rescue meds. They aren't like taking a Tylenol once you already have a headache. They are built to work slowly over time. If you mess with the timing, you risk getting dizzy, and a simple fall is enough to break a bone. For an older adult, a hip fracture can change their health forever, and some people never truly get back to normal. This isn't just being scary, it's just how physics and biology work together. The dizziness happens because the meds are doing exactly what they should: lowering your pressure. When you stand up too fast, your heart and veins haven't had a second to adjust yet. Your pressure drops for a moment, less blood hits your brain, and you feel that tilting sensation. The fix is usually very easy. Just stand up slowly, sit on the side of the bed for a minute before you get up. Hold onto a chair or a table to steady yourself. Give your body those extra few seconds to catch up. But here's the part you need to watch for. If you are dizzy all the time, or if it doesn't go away after a few weeks, you need to talk to your doctor. You might need a different dose or a new plan for how much water you drink. Staying quiet about it is a huge risk you don't need to take. Which part of this has surprised you most? Drop it in the comments below. Think about how well you slept last night, if you had your morning coffee, or if you're dealing with any pain. Even feeling anxious about the test itself or walking in from the cold can change everything. Did you talk loudly right before sitting down? That matters too. One high reading on a random Tuesday after a bad night doesn't mean your pills stopped working. Likewise, a low number after a hot day of sweating doesn't mean your dose is too high. If you're finding this helpful, please hit subscribe and tap the bell so you never miss these vital health tips. Now, here's the secret to getting it right. It's all about the long-term pattern. You need to measure consistently using the same arm at the same time every day after 5 minutes of total silence. No rushing and no chatting. When people check their pressure randomly and freak out over one number, they start making dangerous choices. But here is where it gets really risky. People start taking extra pills out of fear or skipping doses just because one number looked okay. They make frantic calls to the clinic about a reading that is actually totally normal for that moment. You have to monitor with a real system. Write it all down and bring that log to your next checkup. Let the patterns guide the talk, not your panic. This simple change lowers your stress and gives your doctor way more to work with than a single blurry photo of your monitor. If you've made it this far, type the number 9 in the comments so I know you're following along. These meds need a steady, constant level in your body to work. They aren't like aspirin for a headache. They are tools for your long-term survival, keeping you safe one steady day at a time. Which part of this surprised you most? Let me know below.